Dostal. And Drew, you brought somebody with you this morning, and we're going to be chatting about her. Tell us a little bit about her.
Absolutely. Good morning, Chris, and everybody out there. This morning I have Dr. Mary Ivey with me. She's a new OBGYN that we have in town here in Ludington. We're really glad that she's joined our team. She joined us in September, really full-time. She's been doing some part-time work for us for quite some time now, getting to know us. And she moved to the area and actually lives right here locally. So you'll see her out and about as well. And we're really excited to have somebody take that spot, and join Dr. Gentry. And so we're building that practice back up.
All right. Looking forward to that. And Mary, Dr. Ivey, we're going to put you on the spot a little bit this morning. That's okay, sure. Right? All right. And you are part of the community because, like, just a few moments ago, you'd mentioned, Chris, I walked by the radio station, and I was like, for the last few minutes, I was like, I know you for some reason. and so you've been here in the Ludington area since a little bit before September, right? Or longer than that?
I started...
Come closer to that mic if you can.
Okay.
Yep, there you go.
I started taking call like 1 week in a month in January.
Okay.
So I've been here since January.
Oh, yeah.
And we bought our house here in the fall before that. So it's been almost a year since I've owned a house here.
Yeah.
And I just live just a few blocks from here. So I walk my little dog past your station a lot of mornings.
All right.
Yes.
And Hudson probably recognizes your dog a little bit, our radio dog. Shocking, by the way, and congratulations that one of the things that I've just pulled out of your comments was you were able to find a house. Nice job.
Oh, I'm so thankful. Yes, absolutely.
That's good.
That was quite a blessing for sure.
Well, welcome to the community, and we'll chat with you in just a few moments. But Drew, from the president's standpoint, let's kind of just run down some of those, points that you drew you into bringing Dr. Ivey into the Corewell Health team.
Yeah, well, women's health is an area that many rural communities are very much struggling with right now. As we all know, it's getting harder and harder to find people who want to move to our communities sometimes just because there are fewer physicians coming out of training. Women's health is a tough one to get people to go into as well. It requires a lot of call and a lot of responsibility. So sometimes joining a practice with smaller amounts of people is a detractor when they're looking at positions. They'd rather be on call maybe once every 13 weeks instead of once every week. They're on call for a whole week, basically.
Yeah.
So it's very exhausting. So we've really had a heart to do that and build that service line. And with Dr. Gustafson recently retiring, we knew we had a spot coming up. Mm-hmm. So I was lucky enough to meet Dr. Ivey when I came back through a mutual friend of mine, Dr. Hengy, and was very pleased to get to know her through the years and she said that she wanted to move here. So we made that happen, and I'm really excited about that for the people of Mason County in particular.
And two things that come to mind. One is that this helps prevent no sort of lapse or shortage or even extension of time getting into appointments. That's my first thoughts, right?
That's the goal, absolutely. To get people in and get people seen, especially when they have an issue that comes up that needs urgent care. We want to make sure that people are getting what they need without having to travel. We're very blessed in Corewell Health to have the Helen DeVos Children's Hospital, as everyone knows. You can go there and receive fantastic care, but we do really fantastic care locally as well. So we want to keep everybody we can local, and that's part of the mantra you've been hearing me say since I've started the radio program with you over 3 years ago.
Absolutely.
Now, so.
And those second thoughts, Drew, is that looking at the resume that Dr. Ivey brings to the table, there's kind of an expansion of services that you can provide too, right?
Yeah, she's going to talk about some of the things that she can do that are very specialized, but she has built quite an expertise with the robotic surgery. As we talked about last time I was on with Dr. Autry, we were talking about the new robot and some of the things that they can do with that. She can do a lot with this thing, and it's quite amazing. It's good to get that. We want to use it as much as we can, obviously, because it, minimally invasive surgery is really the key in pinpointing what they're doing. She has a lot of really neat techniques. We were just talking about them in the waiting room, some of the new things that she likes to do, and it's exciting for me to know that people are going to get that high quality of care.
Excellent. Well, Dr. Ivey, listening to Drew talk a little bit about you, and by the way, welcome to the community. I think that's
Thank you.
important to say that. What brought you? What drew you to the Ludington area? Did you visit Ludington before? Do you have family here? Was it just, hey, I wanna be a part of Corewell Health?
Well, so great question. So I started my initial practice in OB-GYN in Petoskey. And after just a short time there, I came south to Manistee. And after a few years in Manistee, kind of got lured back to Charlevoix area. So I was there in Petoskey. But I just love northern Michigan and the Lakeshore, and definitely with like friends and family in this area that brought me back to Ludington. And with Ludington, it's just a perfect size hospital. It's not super busy like Drew was mentioning, like practices of many physicians when you're on call maybe once every 13 weeks, but are in smaller hospitals where maybe you're on call all the time. So this is a nice balance. We have great nursing staff. Our nurses in our OB floor are just phenomenal. They are wonderful, and that really made me feel comfortable. And I started taking call here in January to know that we have high quality nurses taking care of our patients, and I can trust that they take good care of our patients.
Absolutely.
So I'm happy about that.
Take us through, we're going to put you on the spot. If you were going through an interview like you would with Drew and the team at Corewell Health, your background, education, where did that start? Take us through that.
Well, I'm a Southerner by heart. I grew up in Alabama, and I did my undergrad at Troy State University, which is a university about the same size as like CMU.
Okay.
And then I studied, my undergrad was in chemistry, and then I did my master's in biochemistry, and that was at Auburn University. So War Eagle, if people know that.
Absolutely.
My dad would be proud. And then I did research in biochemistry for about 5 years, and I did that research in the University of North Dakota. And then I decided to go to medical school, and I went to medical school in North Dakota, so the University of North Dakota School of Medicine. But I just fell in love with obstetrics and gynecology, and all my friends who were doing OB/GYN, they all came to Michigan.
Okay.
Before that, I didn't know Michigan at all.
No.
So I did my residency in Grand Rapids at the Blodgett St. Mary's hospital system, and I remember my very first interview for a job. It was in Escanaba.
Okay.
So in Escanaba, 20 plus years ago, because I've been in practice for 20 years, so we're talking like 20 plus years ago. Escanaba was not very built up, and I don't hunt or fish, so that wasn't really for me. But we stayed in Petoskey that weekend, and I just fell in love with northern Michigan. I'm like, well, this is a place I could live.
Well, I'm hoping that you didn't look at Escanaba as, this is Michigan. No, I hope not. That's the impression of it. But it has built up since then.
It's
so
gorgeous.
Definitely
phenomenal.
different.
It's so beautiful.
Yeah.
I was there recently.
Yeah, absolutely. If you're just joining us, we're talking with Drew Dostal, President of Corewell Health, Ludington and Gerber, and as well Dr. Mary Ivey, OB/GYN surgeon for Corewell Health. Getting to know her, and I think that helps to make sure that when we have conversations like this, that the patients, the community wants to know who you are and be able to trust you, especially when it comes to women and the specialties that you cover, right? Isn't that important?
Oh, absolutely. When I was a brand new doctor, I wanted everyone to love me and all my patients to, obviously, love you. But I learned early on, when you start to build that relationship, and even you can feel that if someone trusts you or not. If they don't, let me help you find a doctor that you can trust, because that's so important. Because if they don't trust me, then they're not going to be compliant with what I ask them to do.
Yeah,
and it's really important. And, I love what I do. I mean, I love women's health, and I love taking care of women. And I mean, as a woman myself, I mean, now I'm in my menopausal years, and that is such a passion of mine to take care of women and this health. That's part of our life. But we have a lot of our patients now are young, and they're having their babies and their children. And that's such an exciting time.
Yeah.
And definitely can bond with them for that. So, and then help them through all those other stages of their health care that they need. So
when we talk about the services and specialties, as we talked with Drew just a few moments ago, and I say this, and not in a bad way, but what do you bring to the table? What kind of services do you offer that the community should know about?
I guess obviously I'm an OB/GYN, so I deliver babies, I take care of women, and during their pregnancies, but also before they're pregnant and helping them get pregnant, and then even after those years of having their babies before they go through menopause. So maybe they need help managing their like heavy menstrual periods or birth control or family planning, and I offer all, whether it's surgery for the tubal ligations or endometrial ablations to help with heavy bleeding, or whether it's IUDs or if they need a hysterectomy. And that's what's really nice, especially with the robotic surgery that's available now. Robotic surgery wasn't part of my training when I was training as a resident. That wasn't there, but I was able to learn those skills about 6 years ago, and 5-6 years ago, to start learning to add the robot, and it's phenomenal.
Yeah.
What you can do with a robot is so meticulous. You can make little small incisions in the abdomen and do major surgeries with small effects to the patients, and they heal quicker, and they have less pain medicines, and they get back to work and life a lot faster.
And that would be one of my questions too, is that with technology, with the robots that Drew and I talked about just I think a couple weeks ago, and you've been practicing for 20 years roughly. Is that one? And if there are other areas that you've seen different or changing in your time that has made your job easier, or the way you practice a little bit easier?
Well, not only the robotic surgery, I mean, that's phenomenal as far as major surgeries like hysterectomies that a lot of women have to go through, but even like pelvic floor surgeries and treatments for urinary incontinence, a lot of women don't talk about that, but a lot of women suffer from incontinence, and now we have a lot safer, minor procedures to help in that we can do, and their recovery is 2 days versus 6 weeks or so. So it's really phenomenal, the things that we can do now with the technology. So.
That's great. If you're just joining us, Drew Dostal in the studio with us, President, Ludington Hospital and Gerber Hospital, as well as Mary Ivey, the OBGYN newest surgeon that has joined the team there. Drew, is this the end of the expansion of the OB program at Corewell Health, or do you see more in the future there?
Well, we're really excited that we actually have more that is coming very soon. We have 2 committed certified nurse midwives. We've never had a midwife at the hospital. So I'm really excited about that. They'll work hand in glove with our physician team. So other options for ladies when they're having children, to work with a midwife and just have that level of care that they bring, which is quite good. It's really amazing how that whole profession has grown through the years, and it's quite remarkable what they can do. So I'm really excited I'll be introducing them when they get here. That's happening shortly. So it'll be just a few weeks really, and we'll have our first one. And then when she gets settled, we'll bring her on and introduce her to the community. So that's really exciting. And yeah, we just intend to keep on. We have that new birthing center at the hospital that's been there it's 4 years old now, but it's just a great place to receive care. So just really excited to be able to provide that service. It's something that we've needed to do.
Absolutely. Dr. Ivey, just listening to Drew, you are getting some support in your area, some additional support in your area. But in the back of my mind, I was thinking, women here in the area, what do you think what's the priorities that they're looking for in healthcare these days, or services when it comes to OBGYN? Is there kind of like the priority list that you can think of when it comes to your area or your services?
Well, I think it depends on their age group, but
Okay.
the young women that are having their children, they definitely want a place to deliver their babies that's safe and that's supportive, and that they can access the care that they need, and not have to travel so far. Some of our patients are high-risk patients, and we're able to share those care with the high-risk physicians in Grand Rapids, which is great. They have a great support team there. So
Without having to drive to Grand Rapids, right?
Sometimes they may have to, but they also can have some consultations. We can do their ultrasounds here, and the MFM, that's a high-risk doctor, can review those and help give us recommendations for their health care.
Okay.
So that's great.
So. What about your highlight of your career? I'm going to bounce around there. Your moment that you're like, yeah, this is what I want to do. This is why I'm doing it. I would assume all the babies you delivered. Do you keep track of your babies that you deliver, by the way, at all, or not?
Well, it's funny because for years, I've wanted to be a doctor since I was 6 years old. So this is what I've always wanted to do. But deciding to be an OBGYN, the very first delivery I did, I still remember that. I mean, I have a picture of his name is Elliot. I still have a picture of him.
Very cool.
But I started like a little like beautiful vase of like little beads now, and every delivery I have like with
Really?
so little girl put a pink one in, little boy put a blue
That's
one
cool.
in,
Yeah.
and so for some of those little angels that don't make it, they're like a little gold one. So.
Oh yeah, absolutely. Well, we appreciate what you do and joining us this morning. You have to be able to disconnect a little bit from work too. You have to be able to have your own personal life and such. So, who are you outside of work? Take us through that, if you don't mind.
Well, with Northern Michigan, I love to be close to the water. I love to take beautiful sunset pictures here, which is easy to do here in Ludington. Love to be outside in nature, running, walking, hiking. Like I mentioned, I've seen your station by walking my dog past here, so I'm out with him quite a bit, and that's kind of fun. So, and just being involved.
All right. Well, again, welcome to the community. And if somebody's interested in becoming a patient, being able to see you, what's that first step? What's that conversation like? And how can they reach out to you?
Oh, well, they can just call the office and make an appointment. So that's 231. I'm still learning all the numbers.
No, it's okay.
843-6767.
Okay.
So that's easy.
And you are taking patients.
Oh, absolutely.
Okay, good. I want to make sure.
Absolutely.
No,
Absolutely. And I see patients whether they're for abnormal bleeding or for pregnancy, if they're perimenopause or menopause, if they're having painful intercourse. I mean, a lot of ladies don't talk about that either. And that's definitely a passion of mine to help women through all the phases of their life be as healthy as they can.
What is that message, by the way, for the women in the area to have that conversation with you, to reach out? What, I would assume obviously there's the confidentiality that goes along with it and the privacy and such, but what's the bigger picture for you to encourage them to reach out?
Well, I think, the way I approach my patients is that I'm part of their team. We make choices together, and I help them understand what's available and what maybe, first of all, and find out what's going on. And that's a long conversation. And, and then an examination, and then say, here are the options. And I try and do everything as naturally as possible, especially with, vitamins or supplements, anything that you can do without trying to use a medication if you don't have to. That's my first line. And then maybe sometimes we have to add a medicine or a procedure. So.
Okay. All right. Well, it's good. We'll repeat that number here in just a matter of moments and put it in our comment section on our Facebook and our YouTube channel. But Drew, you've listened to our conversation a little bit with Dr. Ivey this morning. Anything that we want to add that we haven't talked about that's important to you?
I don't think we can add much to that. I'm just really glad that she's here and getting to know the community. And as you get a sense for why I was so interested in having her join just by meeting her on the air. So I think that as people get to know her, they'll find out she's about the most genuine person you'll ever meet. Cares more about women's health than anyone that I know. So she's really just always studying and learning. So it's a very educational opportunity. When you do meet her, you'll learn a lot.
For sure. And this guy's health, too. I appreciate your thoughts. We were talking before we went on the air. I'm working on the diabetes and the psoriasis and every other health issue that has plagued me. But you could definitely tell your true care for anybody and everybody out there. So I appreciate you. And thanks for joining us this morning. I'll give you the last word. Anything that you want the community to know about you or your vision that we haven't talked about?
Well, just know that, my heart is open to them, and I absolutely want to help them live their best life.
Good.
So.
Yeah. I love that statement. If you want to get a hold of Dr. Ivey, again, that phone number, 231-843-6767. Reach out to her office. And Drew, I appreciate you bringing in Dr. Ivey today and us getting to know her a little bit there.
Thanks for having us, Chris. It's a pleasure as always.
Yeah, absolutely. If you missed this segment, you can watch it in its entirety on our Facebook pages, Hot Country Hits 99.9 and as well 102.7's Facebook page or our YouTube channel. And check it out and get to know Dr. Ivey. And as people see you in the community, I'm sure they will be talking about your dog potentially. Kimberly, and
Roscoe.
that's Roscoe. That's right,
Roscoe.
and other things. And I hear you're a runner as well. Quite a few marathons.
Yes,
and such.
our next adventure is the turtle race on Mackinac Island.
All
I think
right.
we're going to walk this because we have a few people in the group that have some injuries. So, but it's a beautiful place to go for the end of fall or the end of October.
All right.
So.
Well, good luck in the race there.
Thank you.
Yep, absolutely. It is 9 o'clock on the dot here on Hot Country Hits 99.9 and 102.7.